Hello, my name is Judy Sheridan Gonzalez. I'm a registered nurse in emergency medicine, and I'm the president of the New York State Nurses Association, and I'm welcoming you to our union.
My name's Emily Wood, and I want to talk to you about your union, New York State Nurses Association, NYSNA, and all of the things that we've been able to accomplish. The first thing to remember is that NYSNA is the professional organization for registered nurses in New York State. With our nursing practice and policy departments, NYSNA is instrumental in working with the State Board of Nursing and Department of Health to make sure that our practice and our patients are protected. Our role as nurses, as RNs, requires us to be patient advocates, and we take that seriously in fighting to make sure that our patients have access to care and ensuring that there are safe staffing ratios. Patients are our first priority.
You can talk with me. You can stop and take more time with me than just nursing care.
It just gives you hope. It gives you a sense of you're going to get better.
When you have someone that's making sure you're good, it makes you feel better. Like, you know, someone cares.
There's so many reasons to join a union. Number one is benefits.
You have a union that says, we're gonna make sure these hospitals hire you. And guess what? Not only are we gonna hire you, but we're gonna pay for you to go back to school.
My bachelor's is paid for, and currently my master's is being paid for, and I'm almost done.
Being in a union means great wages. Every year we get a guaranteed annual increase, and then we get a cost of living increase on top of that.
NYSNA provides us not only with staying at one level, we move. As we move up the ladder, you get better education, and we negotiate for better salary.
One of the great benefits of being in NYSNA is having a pension plan.
The healthcare benefits, you go to the doctors, you don't have to pay a lot of money for your coverage.
Even our family is covered, like our spouse, our kids. If they don't have like another insurance, of course, they're covered under our insurance.
There's job security when you join a union.
As a member of a union, I have a collective bargaining power that I didn't have on any grounds when I accepted a job offer in a non-union facility.
We've experienced it at our hospital when we had a union that was closed, and the decision was made to lay off a lot of workers in order to meet their financial goals. NYSNA, along with the nurses, took the stand that absolutely not. Not one registered nurse was laid off.
NYSNA has really empowered nurses on how to advocate for their patient, fight for their patient, and make management to be aware if something is not being done the right way.
Management wants to reduce costs, which may sound like a good thing, but in actuality, it's not safe for you or your patients. Being a part of the union allows you to support safer staffing ratios, being able to honestly get your breaks each and every time you come to work, and then letting others know how to advocate as well so that they can join us in our struggles. Right now, the safety of your job is under attack from corporate interests.
There's now this huge attack on unions across the country.
Being a part of the union, we're basically leveling the playing fields against these large corporations who have tons of money and a lot of power.
The only way to protect ourselves and protect our families and protect our patients is to unionize.
Strength is in numbers. The stronger we get and bigger we get, it's the more we realize our union cannot break.
The way we pay for all these things is through dues. Dues give us the resources that we need to fight for our patients and for ourselves. But it only works if everybody is involved. The point is, NYSNA is us. We're made up of nurses. Together, we take care of each other. We have each other's backs. We're there for each other. In front of you, you should have a list of delegates, and these are the nurses just like you to help guide you in your personal journey here. If you have questions, if you have concerns about anything here, reach out to one of them. Questions about your benefits, education, even where the break room is. Just ask. You're important, and we're glad that you're here.
You can't be a nurse by yourself. It takes a village to really care for our community.
We are upstate, downstate, all around town. We have over 42,000 nurses in NYSNA.
You are the union. It's you that's the union. It's not a building, it's not a fictitious individual. It's you who make the union and your participation. You may have something to offer that no one else there has.
We are Black, white, Asian, we are Afro-Caribbean, we are Filipina, like we are from everywhere.
So here's what I'm saying. NYSNA is the professional organization of New York State that allows us to fight for patients and ourselves. We've spent years improving wages and benefits, and these are guaranteed in our contract. The nurses are NYSNA, and we're here for you. Our organization only works if everybody's involved, so we need you. What can you do right now to protect the license that you have worked so hard to get? The first thing you can do is sign up to be a member. Sign the card in front of you. The second thing, reach out to your delegates. This way we can keep you updated about everything here and about your practice. Finally, come to a meeting. We have union meetings every month, so join us.
We are nurses!